Like if I told you some of the stuff that I've seen, it would be, what snake oil are you giving me, or how is that possible? But when I'm reading his book and he talks about things that they've seen in their clinics and in clinical trials, and it just solidifies the benefits of stem cell therapy.
So is what you've seen in your experience, does it correlate with what's talked about in the book?
Yes, it does to the most extent. And I think the number one question most patients have is, how often will I have to do this? Is this a one-time thing? And in his book, he talks about different disease processes, I guess you could say, because we should know by now that most of our disease processes and our autoimmune stuff is from inflammatory reaction. So if we can decrease the inflammation. But anyway, so he talks about how sometimes after a year or after 6 months or after 8 months, people with certain conditions are having to have more than one treatment.
Yeah.
Where it's been in my education so far that 85% of people that come in just need one treatment. But it really depends on what you're doing. If it is an acute injury, one treatment and it should be golden. But if it's a long-term, and we've talked about that before, if it's a long-term chronic thing, then it's one of those things of you've got to learn what your body feels like and how to know whether it's working and recognize the benefits of it, and then recognize when it's starting to wear off, because your body clears that within the 8 months, according to the book.
Wow.